Welcome. Good morning, everyone. Thank you for joining us for this Facebook Live virtual media conference. I'm John Canosa, Director of Public Health at the Clinton County Health Department. Joining me today are Dr. Mark Davey, District Superintendent and CEO of Champlain Valley Educational Services, and Dr. Walter Rietzema, Vice President for Population Health and Information Services and Infectious Disease Physician at UVM Health Network, CVPH. We will each provide a brief update for you today, and we will do our best to answer your questions after that. Since we anticipate duplicate questions on the same topic, please listen carefully, as the information you are seeking may be answered in the prepared remarks that we will provide, or as part of a response to a combination of questions. A closed captioned recording of this session will be available on CCHD's YouTube channel later today. For all of your information, as of this morning, we currently have 132 active cases of COVID-19 in Clinton County. We continue to see a significant number increase in positive cases in our community, especially compared to what you will remember and what we had over the summer and early fall this year. As we have reported previously, in response to this increase, our staff continue to work very diligently on contact tracing and case management. Even though we have added additional members to our contact tracing team, and we are utilizing the New York State Virtual Contact Tracing Center to complete contact tracing, notifying and monitoring close case contacts has been a tremendous lift for public health systems everywhere, including our Clinton County Health Department. As always, we continue to communicate frequently with other partner agencies, including CVPH, SUNY Plattsburgh, and CVES. And we are truly grateful to our partner work that we're doing with all of our local partners. As Dr. Rietzema will discuss, CVPH continues to provide a significant number of tests each day at their former CVPH Wellness Center located at 295 New York Road on the former Plattsburgh Air Force Base. At this holiday time of year, it is important that I talk about the primary causes of positive cases occurring across New York State. For those cases where a specific source of COVID-19 infection could be determined in our state, about approximately 46,000 positive cases. Over 70% of these 46,000 cases have been specifically identified as occurring directly related to household and social gatherings of some sort. Since the Thanksgiving Day holiday, we have seen over 200 new cases in Clinton County. What we are seeing locally is very similar to what is being seen across the state. Spread of COVID-19 is largely occurring between friends and family members. People, as you can see on the street, when you go out in public, are taking the appropriate precautions when they are out in public, such as wearing face masks, being reasonable with some physical separation distancing. But then they're getting together with friends and family members who don't live in their home, and they're not taking those same precautions during those interactions. Keep in mind that you can begin to spread COVID to others in the 48 hours before you start to show symptoms. And some do spread COVID to others without ever showing symptoms themselves. If your holiday plans involve individuals who do not live in your households, we urge you to reconsider your plans. I'd also like to talk briefly about the recently approved COVID vaccine. Dr. Rietzema, of course, will be covering this in more detail, but I feel it's prudent for me to also mention that while we are so happy, ecstatic, that there is now an approved and recommended vaccine for COVID-19, please understand that the rollout of the vaccine to everyone isn't going to happen overnight. Current supply of vaccine is limited, and high-risk healthcare workers, nursing home residents, and staff are being prioritized to be the first to receive the vaccine according to the New York State COVID-19 Vaccination Administrative Program. The vaccine is not yet available to the general population, and there are no wait lists that residents may wish to have their name added to at this time. There is a light at the end of the tunnel with vaccines, I'm happy to say that, but immunity is going to take months. And for now, the pandemic does continue. For now into the future, we must not become complacent in our daily activities. We in public health cannot stop the spread of this virus on our own. I truly wish I could do that. We need your cooperation and participation in these efforts. Please, please continue to wear a mask correctly and consistently anytime you are out in public near individuals who do not live in your specific household. Face masks should be worn by all persons age 2 and above. And on mask wearing, please remember that surgical masks, like the one I have on, cloth masks, are appropriate face coverings, and that gaiters and bandanas are not recommended simply because they don't. They do very little and add literally no protection to minimize the spread of COVID-19 virus or for the seasonal flu. Seasonal flu. Our primary messages to the public continue to be: please continue to distance yourself at least 6 feet from others. Wear a face covering face mask correctly and consistently. Wash your hands with soap and water, or use a hand sanitizer with at least 60% alcohol if soap and water is not available. Avoid crowds and gatherings of all sizes. Very important. Stay home when you're sick. Also, get your flu shot. These actions do work together to reduce the risk and spread of COVID. However, it is important that you understand that these actions don't eliminate all risk. They are all important measures and can be effective in decreasing the amount of virus that one is exposed to. But right now, with the community spread that's occurring, there's a level of risk involved with every interaction in the public. Your interaction could result in a relatively minor inconvenience of a 2-week quarantine or a serious illness with long-term consequences for your health or even death. My closing words include the simple reminder and request to you all with the holidays upcoming. Please focus your plans to protect those near and dear to you by thinking small and local when it comes to our intentions for upcoming celebrations and holiday gatherings. Don't give COVID-19 the chance to spread to the people you care most about. You can protect your family and yourself by staying home with your immediate family. With that, I'm going to turn the speaker over here to our next speaker, Dr. Mark Davey from CVES. Thank you again.
Thank you, Mr. Canosa. Good morning. We are in our 15th week of hybrid in-person classes, and I want to begin by thanking everyone involved for working together to keep our schools open and our students, staff, and communities as safe as possible. Students, parents, guardians, administrators, boards of education, our teachers, our staff, including bus drivers, cafeteria workers, and especially our cleaning staffs, have all done an exceptional job in ensuring that we are continuing to offer in-person instruction whenever and wherever possible. Continuing in-person instruction remains our central goal. At our last news conference, Mr. Canosa, that was on November 19th, just before Thanksgiving, I, along with our other speakers, emphasized the importance of maintaining healthy and safe protocols throughout the holiday season to minimize the potential spread of COVID-19. We asked the community to limit Thanksgiving gatherings and travel due to the risk of exposure to COVID-19 and the spread that was almost certainly following. At that time, on November 19th, there were 20 cases, or there had been 20 cases of COVID among students and staff in our 16 school districts served by Champlain Valley Educational Services and CVES BOCES. I would like to remind you of the website that tracks COVID in schools. Here is the address. And this is one word: School COVID Report Card. School COVID Report Card .health.ny.gov. Today, 4 weeks later, that number of our cases from our schools has more than doubled to 45 cases as of this morning. Some health experts attribute that increase to small gatherings such as Thanksgiving dinners, birthday parties, travel to other states, or even within our own state, especially during the Thanksgiving break and subsequent community and regional spread. As a reminder, our 16 component districts and CVES BOCES, pre-K through grade 12, there are approximately 14,000 students and over 3,200 full and part-time staff members working in our schools. With 45 confirmed cases in local schools, our infection rate is relatively small in comparison to that of other areas of the state and nation. However, we all know that can change quickly. Even one case is too many. Therefore, we are here this morning asking for your help again in lowering that number to 0. We at CVES and every school district in the state understand the important role that schools play in our community, not just in educating our children, but also in supporting our families' work schedules. As I said earlier, our goal is to continue for some schools to resume in-person instruction while we provide the highest quality education possible. Our ability to do this depends on several factors. First, a safe school environment. CVES, along with every school in our area, has developed and implemented a comprehensive plan to ensure this, including extensive cleaning of our school facilities, including buses, wearing masks, frequent hand washing, social distancing, and hybrid or remote learning. This has been successful in limiting the spread of COVID in our schools. Second, while these measures work as planned, our students and staff are not in school 24 hours a day, 7 days a week. We must depend on each other, the entire community, to continue healthy practices outside the school environment, at home, at work, while shopping, and while celebrating the upcoming holidays. Finally, our ability to keep our schools operating safely depends on all of us. Your school, our schools, cannot do it without your help. We all want the same thing: for our schools and lives to return to normal as soon as possible. I ask you to help us, as difficult as it may be. Please limit your holiday gatherings. Please limit your travel to visit family and friends or for vacations. Practicing COVID health protocols and wearing a mask whenever possible. Washing your hands frequently, social distancing, and limiting contact from others outside your home. This will avoid repeating the spike in COVID infections that followed our Thanksgiving break. I know we're all tired of this. We all are. But we can't ignore it, and we have to deal with it. Together, we are North Country strong. Please help us all, including our schools, be North Country safe. Thank you, and I wish you all a healthy and happy holiday season. I would like to just answer a couple of questions that have come up as we prepared for this conference. First, the question was, which schools are currently fully remote? I ask each district to refer, or each community member and school member to refer to their district's website. Second, there is no evidence that COVID has been spreading in our school buildings extensively. I'd like to first acknowledge that our component school districts, CVES, the health department, Clinton County Health Department and Essex County Health Department, as well as all of our health professionals in the region, have been working very closely together in collaboration, many times meeting weekly and continuing close communication, especially when there is a positive case and contact tracing is required. That has been essential in helping us address each and individual case. So the question is, why not open and reopen for in-person instruction? I'd like to remind everyone, yes, we've been fortunate to have a relatively number of lower cases in our schools from September through December, through today. However, and this is very important, even a single case can result in larger school students and staff quarantines. There have been numerous instances in our schools where a single case has needed between 125 staff and students or more quarantined. This can include staff, support staff, bus drivers, food service workers, O&M staff, as well as all of our students. Each district is therefore responding to their school district needs and making their best decision possible based on their own school's needs and feedback at each day. Sports, that's generally an area which is very much a priority. Recently, everyone may be aware that the New York State Public High School Athletic Association has canceled the Winter State Championships. That has been canceled. What about the upcoming other sports? The New York State Public High School Athletic Association has also continued to postpone all high-risk sports. That includes hockey, wrestling, and basketball. There is no decision at this time, and that decision falls to the governor. What about testing? The regents scheduled for January 2021 have been canceled. There have been no word yet about the June regents forthcoming. And lastly, I would just like to acknowledge that our CVES libraries have expanded access to the e-books and e-audiobooks. This is something that we've made available both through our Champlain Valley Educational Services school library system and Clinton Essex Franklin Library System have partnered to increase access for all of our students to e-books and e-audiobooks for area students. Students can now borrow age-appropriate digital titles from the public library system in addition to those offered in their school buildings. Both the school and the public library collections can be searched through the Sora app. That's S-O-R-A, the Sora app, using one login. Students can install Sora from the Apple App Store, from Google Play, or the soraapp.com. All students attending a CVS component district have a login ID and can contact their school librarian for more information. Thank you. At this point, I would like to introduce Dr. Rietsma from the UVM Health Network and CVPH. Thank you.
Good morning, everybody, and I'm happy to be here, and thank you, Mark and John. I want to cover three topics quickly. The first topic is just a word on testing. As you know, we moved our testing center to the Wellness Center from Connecticut Avenue. We're exceptionally grateful to the county for providing the Connecticut Avenue location for many months, but it became clear with the winter weather that that was not a sustainable plan, and we needed to move indoors, and we have done so. It has largely gone smoothly. I was told this morning that in the week and a half we've been doing it, we've moved over 1,200 people through that testing center, so that is a success. Testing turnaround for asymptomatic free state testing, which is a portion of what we do there, remains at 48 to 72 hours. It hasn't gotten a lot worse. It got a little bit worse over the Thanksgiving week, but has come back to 48 to 72. It's certainly not optimal, but at least we know what to expect. The other comment I will make is to reinforce the comments of John and Mark. I am the technically ordering physician for all the free New York State testing. As a result, every day I see a spreadsheet of all the results. And it is remarkable to me, the family groupings that I see. I have noticed families with 4 generations, from very young to young adults to their parents and presumably their parents. And whenever I see family clusters, I get anxious, and I get especially anxious when I see family clusters with people over the age of 60. As we know, the rate of mortality goes higher. So please, I don't need to say it again, please, please, please don't merge your family pods, your friends pods. We all have a tendency to trust our friends. I know so-and-so, they would never bring COVID into our house. Well, first of all, they may not know it, and we don't know what different families do, and we can't rely on that. The virus does not respect our friends and family any more than it respects us. So please, we have definitely seen a surge from Thanksgiving, and it would be nice not to see a similar surge after Christmas. Now I want to talk about vaccination, which is, on the one hand, extremely exciting, but perhaps for some frustrating. The exciting part is we can now see an end to this epidemic. Being able to see an end is a really big deal. I think for me and for a lot of people at the hospital, we have been positively giddy, and it's not because I've been vaccinated, because I haven't been. I do not fall into the highest risk category, so I haven't been vaccinated yet. But for all of us, to see that there is an end is really exciting. So vaccination at this point, in case you haven't heard, is really limited to 2 populations. High-risk healthcare, which is fairly broadly defined as hospital staff. They are both high risk, but also in a time where we are experiencing a surge, they are currently the most limited resource we have as hospital beds and ICU beds. We're not stressed at this time, but I think the governor wants to keep it that way. The other population is, of course, skilled nursing facilities, both staff and residents. Given that skilled nursing residents comprise 40% of all mortality in this country, vaccination of those facilities is a huge, exciting step, and I know that starts next week. So in our hospital, what we did receive vaccine. Some of it was for us. Some of it is to share with other hospitals. We have vaccinated, as of this morning, I think we were close to 200 people or thereabouts, really focusing on our highest risk people. And risk in our hospital is evaluated by what you do, where you do it, and how old you are. So the fact of the matter is most of the people vaccinated in the first couple of days work in direct patient care and are of a more mature generation, is all I'll say. So given the risks for older people, this makes perfect sense as well. We will continue to work through our staff over the next 6 to 8 weeks. It's going to take that long because, of course, there is a 21 or 28-day space between dose 1 and dose 2. As the supplies increase, we will move then, and I say we broadly, we as a state will move to the next tier, which will be healthcare workers outside of a hospital setting and the highest risk individuals in the community. And I want to stress that is where our expertise ends and the expertise of the Clinton County Health Department or the health department in whatever county you live in begins. Large-scale vaccination of the public is right in the wheelhouse of the health departments, and they will be leading this effort, and we will support however we can or are able. To that end, some of you may have heard on the governor's news conference that CVPH has been asked to be a vaccination hub. I did not see the news conference, so it's not clear to me what exactly was said, but I want to make sure that people understand that we are not a hub for actually performing vaccination. That is not what these hubs are for, nor are these hubs for distribution of the actual vaccine. The hub is really to serve as a convening group of the relevant people across our region, and our region is a 7-county region extending from the northeast counties where we are across to the Watertown area, for planning and to make sure that every county and region has what they need, has the ability to affect their plans to vaccinate the most vulnerable populations and eventually the general population. So we are a planning hub. Apparently we were inundated with phone calls this morning of patients wanting to get vaccine, or wanting to know where to go to get vaccine, or wanting to get on waiting lists for vaccine. None of those is what our responsibility is. And at this point, we are not vaccinating outside of the populations I mentioned. That being said, it's just tremendously exciting, and we anticipate, if the FDA does approve the second vaccine, that we will get delivery of more vaccine next week, so we'll be able to move through our hospital staff with the first dose. So with that, I think I've said enough, and I'm not sure if we will be taking questions now.
We will once Megan gives, okay, she just gave the go-ahead, thank you. So while you're up there, Dr. Rietzma, I think we do have a couple of questions for CVPH. One of the first questions, you kind of just alluded to, but the question is, tell us about vaccine refrigeration capabilities in the North Country. CVPH mentioned, or excuse me, CCHD mentioned earlier this week that they do not have refrigeration capabilities for the Pfizer vaccine. However, Dr. Keith Collins mentioned in a webinar that if Moderna vaccine is approved, places like doctors' offices will be capable of having it.
So yeah, there's the two vaccines, although they are extremely similar in their mechanism of action and in their efficacy, have different storage requirements. And people have asked me why, and I'm not sure why. One of the things about mRNA is that it is notoriously unstable, and it stays stable at cold temperatures. So the Pfizer vaccine requires storage at minus 70 degrees. At minus 70 degrees, that's pretty cold. We have the capacity to store that, and I believe there are a few other hospitals in the North Country. I believe Kenton-Potsdam has that capacity as well. I'm pretty sure Adirondack Medical Center does, although they did not receive vaccine in the first delivery. To maintain that vaccine, you either have to have a freezer, or you can maintain that vaccine as delivered by refreshing with dry ice every 5 days through very specific procedures. We have the capacity to do both. We have the capacity to generate dry ice, and we have the capacity to store vaccine. And to the extent that the health department needs that resource, I'm sure we will be happy to provide it. The Moderna vaccine, fortunately, does not require those kinds of storages. It needs to be kept cold. It's shipped frozen, but at normal freezing temperatures. So normal temperatures are usually in a 0 degree Fahrenheit range. That's sort of, your normal refrigerator freezer. So Moderna is shipped that way, but it also can be stored refrigerated for up to 30 days. So that gives a tremendous amount of flexibility for the health department or eventually for private offices for the vaccine. The next vaccine we see, the next two that we are likely to see are more conventional vaccines. They're not mRNA vaccines. Which means they will probably have more conventional storage requirements, which is generally for refrigeration. As those start flowing, these freezing challenges become less, but there still will be a flow of Pfizer vaccine, and I'm sure the other hospitals in the North Country will cooperate with their health departments to to do that. When we originally ordered vaccine, we did indicate that we would be able to do what's called redistribution. So we will do that.
Much. There was another question. So I know you did mention already how many doses of the vaccine have been administered by CVPH so far. But there was a question just how has that been going? And then also a question about how many doses of the vaccine you have received. Have they been shared with other hospitals? And do you know when you will be receiving more?
Okay, how has it been going at the hospital? It's been going well. The procedures to administer this vaccine are a little bit more complicated, because of the thawing. Once you do thaw and reconstitute the vaccine, you have to mix it up. It's good only for 6 hours, kept refrigerated. So that creates some logistical challenges. There's also additional paperwork, requirements with this vaccine, in part because it only has an emergency use authorization. It's not a fully approved and won't be for 2 years. We've had a team working on it. I think our procedures get better every day, and it's going well. We've actually had a lot of interest. We've had very few declinations so far, and people want this. And I know that people in the community want it as well. Second part of that was, in regards to how many. So I would love to talk about that, but one of the things when we received vaccine, we had to sign a memorandum of understanding with New York State that very specifically stated we were not to talk about quantities shared and where it would be shared. So we will not do that. It's one of the few things that I will not talk about. I prefer to be as transparent as possible, but my boss signed an MOU, and I'm not going to get her in trouble. So we did share that we received 975 doses, and that's because anyone who's reading the news would know that. It's pretty public knowledge that if you're going to get vaccine, it's distributed in lots of 975 doses. But what we do with that, we can't share.
Thank you. One of the last questions for you, Dr. Rietzma, was how will you work with local officials and the community to build trust in the vaccine?
Well, we're starting with our own staff, right? Our staff is part of the community, and even though they're healthcare, they have those sorts of questions as well. So we've provided FAQs to our staff. Yesterday we taped a question and answer period, really leveraging Dr. Keith Collins, who you've been familiar with. He's done some of these. And we will continue to do whatever anybody would like in terms of public relations about these vaccines. As Keith says, and I say, even though these came to market quickly, they were able to do that for a variety of reasons, but one of the reasons they came to quickly was not that any safety steps were skipped whatsoever. All the normal safety procedures in development were followed, but the reason it was done so quickly is because the federal government took the financial risk. They didn't do step 1, step 2, step 3. They did multiple steps at once, and most importantly, they revved up manufacturing capacity before they knew their vaccine was effective. No pharmaceutical company would ever do that in a normal situation. But because the financial risk was taken away, so they didn't do things one after another, they did things at the same time. But all those things had to be done and had to be done safely. So, again, I would offer up Dr. Collins at any time to talk about this vaccine. I tell you, it's safe. I can't wait to get it. I told my team that if they're afraid they might waste a dose because they have a dose left over, they can call me any time of the day or night, and I will drive in and take that vaccine. And at some point, they will get around to me. And anyone in my family, I would urge to get these vaccines. The mechanism is new, but theoretically, frankly, much safer than many other of vaccine mechanisms that we use. So we will find out with time, it is true, but the safety profiles of these vaccines after 2 months have been phenomenal. And most adverse reactions that happens from vaccines happen immediately. So,
Thank you very much.
is that it?
Yes, at this point, yes. Thank you very much. I do have a couple of questions for you, Mr. Canosa. The first question we received was, Franklin County had been asking for contact tracing volunteers and additional help for when a vaccine was going to come out. Is Clinton County asking for volunteers for vaccine administration? How can people in the county help with distribution efforts?
We are not necessarily asking for volunteers at this time. However, please see our website. We have a special group of current, what are called Medical Reserve Corps volunteers that we use. We have a couple of them that are currently serving in our isolation and quarantine team right now, working with our nurses and other staff on contact tracing, isolation and quarantine, and case management right now. These are former nurses, healthcare workers. If you have that type of background and you would like to volunteer in that direction, I totally urge you to take a look at our CCHD website, and you can find information on that there of who to speak with and talk with.
Thank you. There was another question. Why is there a difference between the number of positive tests for COVID-19 reported on the Clinton County Health Department website and the number of positive tests in Clinton County reported on the New York State website?
Okay. Case updates provided directly by the CCHD are the most accurate numbers for Clinton County, New York. You can think about it. Those are our numbers, so we're going to typically know about it first and have them available first. Case data changes pretty frequently, and updates to our data and on the New York State COVID-19 tracker may not occur at the same time. In addition, CCHD reports all cases living in Clinton County at the time of their illness. If individuals are tested in another state or tested within New York State or Clinton County but indicate a permanent home address outside of Clinton County, they may not be captured in Clinton County data reported by New York State, even though they were living in Clinton County at the time of their illness. We have had a few of these cases since this all started back in March.
Thank you. Another question, if you are wearing a mask and a face shield, do you still have to quarantine if in contact with a person with COVID?
Okay. If you've had an encounter with someone, in other words, if you were wearing a mask and a face shield, do you still have to quarantine during that time of encounter with a person who, if in contact with that person that has COVID? It depends. The face shield and mask is totally encouraged, recommended at all times when you're out in public or at work. It always can help reduce the risk, but not totally eliminate the risk. Spacing, separation, and time with that other person, that other COVID positive person, also makes a big difference on the subject matter. So if you perhaps were with that person for a fraction of time, maybe a minute, and you had that separation, our isolation and quarantine nurses would take that information from you and make a determination as to whether you would need quarantine or not. If you spent a lot of time with them, say 2 hours, and you were sitting right next to each other, playing cards perhaps, you're looking like you're going to need quarantine, even though you had a mask and a face shield on. Time and distance make a lot of a difference in these type of matters.
There were a couple of questions about vaccine administration to the public. So one of them being a plan for delivery and administration in the North Country is due to the state by the first week in January. Where is the North Country at in that planning process?
Well, I can only speak about Clinton County. We are currently working on that right now. We're working on just about every front you can imagine right now, whether it be contact tracing, isolation and quarantine. Since the vaccinations we knew were coming, we ramped up our planning for vaccination clinics. As soon as we heard about that, we started up slow but moving fast, and we're going to be ready for it.
Would a plan for administration Vaccines look similar to COVID-19 testing sites. Second part of the question, can the public in their respective phases drive up and receive a vaccine at different locations throughout the region?
That's a very good question. We're looking at both the old-fashioned conventional points of distribution clinics, pods, where you would go into, let's say, the Crate Center or the SUNY Field House and receive a shot. But we're also looking at what work and results we had from our testing at 213 Connecticut Road. That building worked very well, and it may prove to be quite timely when we received larger numbers of doses for vaccinating the public. In other words, we could have a drive-through type of scenario that would work at that type of facility. So it certainly was a optimum facility. We're happy that the county let us use it and let the hospital use it. It worked very well. That type of scenario is on the table.
And then last part of these questions, as of now, does the North Country have the resources needed to begin phase 2 in late January once they receive the doses? So for example, refrigeration, staffing, potential vaccination sites?
Yes, I strongly believe we do. We do have the staff. We have a lot of our partners. I cannot say enough and be grateful to all of our partners that we will be working with, including SUNY Plattsburgh, not only their healthcare center nurses, but also their police, who are very good at doing investigations, contact tracing. But we're gonna be working, pulling out all the stops, working with all of our partners and our current staff to ramp up to be able to accommodate that next phase of vaccinations. It is very important that the public be mindful that this is going to occur in steps. I think the first couple of months is going to be limited a number of doses, just like the hospital just got, 975. But slowly but surely, as more becomes available to us, we're going to see larger volumes of doses being made available to us. Very similar to the testing. The testing first started, it was slow, limited opportunities for testing, but now you can get a test pretty much anywhere. So that's what we're definitely looking at. I give you that analogy makes a lot of sense, I think.
I lied last time. One more question on the vaccine distribution. How will people know when they are eligible to receive a vaccine?
We have a couple of fronts that we're doing. Not only are we doing planning for vaccination and clinics, pod clinics, but also we're going to be working on some messaging, not only in our social media, but also press releases to make formal announcement out to our public, to all of our constituents, all of our patrons, to be letting you know on a regular basis of what we're looking at ahead of time. So we will be messaging everybody.
Okay. Thank you very much. And there were just a couple of questions for Dr. Davey. So there were a couple of questions about the school districts in Clinton County. The first one being, how come all the school districts are not all on the same page as far as in-person instruction?
Sure. Great question. And as I mentioned, each school district and all school districts have been working very closely with our Clinton County Health Department. We have been not only working very closely with our nurses who have been doing yeoman's work in all of our schools, but we've also been working very closely on contact tracing, providing data and resources needed so that the county can do their job as effectively as possible. When there have been individual cases, as I mentioned, there's been varying degrees of quarantining needed. In some school districts, the number of cases that have occurred have been at the elementary level. And that's resulted from birthday parties and other social gatherings. Other school districts have had instances where they've had high school spread with individual cases there, and then larger numbers in many cases of staff and students have needed to be quarantined. As I mentioned, over 125 staff and students. So each district is making their own decision and working with their Board of Education and working in consultation with the health department. We do have weekly meetings where we check in and answer questions, but also provide the latest updates. And there's recent and daily emails and communication So our school districts have been working very closely with each other and with our health department colleagues who've been tremendous in providing all the resources. So each district makes their own decision.
Thank you. The second part of the question, I think you just addressed, but in case there's anything else you'd like to say, the question was, are all of the districts going to do New York Pause after holiday break? Can we all be on the same page for this?
Again, each school district is looking at the data and working with their school communities. Some of our local school districts have worked with their school communities and their school staff and community members to make that decision. Others have waited and are reading the data each day and then making a decision based on that. So each school district is continuing to make those decisions, but we do understand the role schools play, and our goal continues to provide the best education possible for everyone.
Great, thank you so much. And I think that was the end of our questions for today.
Okay, thank you so much. And happy holidays, everyone.
I really like that, Dr. Davey. Yes. Happy holidays to everyone. I love my holidays too, but unfortunately, I'm going to keep it low profile this year. Just my kids and the local family all by ourselves. So thank you again for joining us today. A recording of this media conference will be posted to CCHD's YouTube channel later today. Thank you again, everybody. Stay safe and be protective. Thank you again.